One dental practice, one expert team, one dramatic transformation. This is the ultimate practice makeover.
Welcome to the Ultimate Practice Makeover, where we ask the question, with the right help, how fast can you turn a struggling practice into a thriving practice, and what are the steps? A key way to get your practice growing faster is to offer additional services. And the hottest trend in dentistry is orthodontics, and in particular, clear aligners.
The practices who start offering clear aligners end up with a lot more referrals because patients want to go to someone they trust, and they always trust the general dentist. This is where the fallacy lies. They don't trust me as a specialist, they trust their general dentist. So really, that's where the trust is. They want to go to that practice, they feel comfortable going there, it's convenient to go there. And at the end of the day, you will have so many happy patients that refer you more patients. Your Google reviews, your raving fans are just going to skyrocket, and your profit is going to increase significantly. We have doctors who are referring out close to $1 million a year at the moment. And I can guarantee you they could be referring out 50% less without even blinking an eye, and they'll end up making at least $250,000, $300,000 net profit, an extra $300,000 profit per year. And that's nothing to sneeze at for doing very little indeed. It's the low-lying fruit that we're just talking about.
And so for Michael, that means working out how to introduce clear aligners to his practice. So we're sending Michael to Melbourne to learn all about clear aligners from Dr. Jeff Hall at the OrthoED Institute.
As an undergrad student, we covered a lot of ortho, but since then, I've really just parked it and haven't really paid much attention to it. But it's in the last sort of 5 years, I feel like it's really become more common and more acceptable and more in demand by patients. But I personally haven't done any treatment at that stage. I've always referred out to an orthodontist. I would say now it's probably about 25% of my cases are looking for something, and typically that is aligners, clear aligners. As a business owner, it would be nice to have that revenue coming into my practice. I think it's fair to say I was a little bit hesitant to do the course, and for the obvious reasons, sort of stopping, basically closing my practice for a few days. So there's a lost income from that side of things. There's the busy time of year where everything's starting to, the Christmas rush, so to speak. So all those things, it made me think, do I really need to do this? Is it really going to be any benefit, or am I just wasting my time, really?
So Michael's expressed a number of concerns that are pretty common among dentists. And the big question is, can these be resolved?
Clear aligner market is going to increase by 29% within about 5 years. So it's an enormous increase when you think about it. They're starting off 22 years ago with Invisalign, nobody did it. Now it's a multi-billion dollar market in Australia. Anybody can do this, honestly. And you need a little bit of knowledge, and that's about it. And you can increase your income and increase your patient satisfaction and increase your Google reviews and your raving fans, all significantly with just a little bit of education and knowing something different. He's opened up that space, mesial and distal to those teeth, okay, to make sure he's got the entire tooth surface encapsulated.
So it's a lot of information. Jeff packs quite a bit in. 8 till 5:30 is some of the days we've been doing, and his approach is really to break down the myths, I guess, or the beliefs that general dentists can't do orthodontics. So he really tries to bring it back to basics and really just to explain how, when you are back to basics, it's quite a simple logic, and the treatment plan going forward should really make sense. So he's really simplified it. Is probably the best way to do it.
The increase in demand is absolutely massive. I would never, ever have anticipated it. We started doing courses about 3 or 4 years ago. We might have had 25 people at a course. Today we're doing a course now. We've got over 130 people. This particular year, we have trained over 300 dentists in just clear aligner therapy, which is just massive. Yeah, that's a 15 times increase. And we had to close off our books because people just want to learn about clear aligners. This is the future. This is the next thing in dentistry. If you want to stay competitive, you've got to be providing at least basic orthodontic alignment, whether it be great alignment, and that's all they need, or probably more importantly, even just pre-restorative alignment, which is what these dentists need to improve the outcomes for their patients and do what we call minimal restorative dentistry.
The best takeaway I've had so far is A, that it's nothing to be afraid of. B, that it's quite important to pick the right cases. So there's clearly going to be cases where having a 3-year specialty behind you is necessary. So he's really emphasised that, go for the simple cases and really pick the cases that are going to have the highest chance of success. So that's probably the takeaways.
It was really interesting to meet Michael at this particular course. He was so excited. He had so much enthusiasm to learn about aligners. He had great questions. And it really warms the cockles of my heart to be able to take a dentist who refers everything out at the moment, and now he's seeing all this low-lying fruit. He's even seeing potential of even higher expectations that he can achieve. And he can't believe how easy it is, provided you understand sound principles. And that's what we are doing over these 3 days, is teaching Michael sound principles. And he says this is fantastic. And I can't wait to see the number of cases that he starts to do in the next few weeks.
Thank you very much. Look, the course has been great. It's been informative. It's really clarified what I need to do going forward. Another good thing about Jeff is he offers great support to anyone who attends his courses. So you feel like you've got a bit of support of someone to talk to if if you've got a question. So I've learned a lot, and I'm confident now that I can go forward and try some orthodontic cases.
At least every second month, I get at least one dentist that is referred to me by APRA for me to supervise their ongoing care of patients. Otherwise, they are not allowed to practice in the area of orthodontics. And the majority of these doctors have fallen foul of APRA in aligner therapy, in delivering ideal and optimum aligner care to their patient. More likely the reason is they have not undergone the proper training. They believe as a myth, as a fallacy, that whatever the aligner company gives them as a setup is all they need to do, and they press that approve button, which is so far from the truth it's not funny. So we have to educate these dentists in understanding what they need to know to provide predictable and efficient aligner therapy and provide good quality outcomes in the most reasonable time frame, because we need to manage these patients' expectations.
Not only have I learned more about the principles involved, but I can also now see that someone with my type of care and treatment of patients, I think will be quite successful in doing those cases. And there's going to be cases where I need to refer out because they're the complex cases. But yeah, I would hope that I can get to the point where probably one out of those two cases I would be able to do in-house, which would certainly be a big plus for the practice. So that's exciting.
In the next episode, the team get to try on their new uniforms, see the new website in action, and we've got Michael Cernick talking about patient education.